Hi everyone, I am Dr. Danish Salim. Today we are going to discuss about Omicron, the new variant of COVID-19. First, what are the main clinical symptoms of Omicron? It mainly includes sore throat, dry cough with less phlegm, chills and fever, headache, nasal congestion, body pain and fatigue. The sore throat can be very much severe and patients sometimes describe that they have never experienced so much pain in their entire lives. Second question, what if I have the above symptom but the self-antigen test is negative? If you have the above symptom, the probability of Omicron is very high. You can test again in 2 to 3 days or go to the laboratory for a RT-PCR test. How long did the above clinical symptoms last? It's another question. It is longer than we originally thought. We thought that it would last for 5 to 6 days. Now we think that it will last around 14 days. But the degree will be lessened day by day. So the people who have received 2 doses of COVID-19 vaccine or have previously had a COVID infection, will they get Omicron? Yes, the neutralizing ability of Omicron by antibodies produced by previous vaccines or diseases is significantly reduced, which we call immune escape, so you can get infected. Why is Omicron symptoms relatively mild? There are 2 main reasons for that. Although the neutralizing ability of Omicron by the antibodies produced by the previous vaccine or disease is significantly weakened by the T-cell immune function produced by the vaccine, or disease can still play a role. The second important is the pathogenicity of Omicron itself is weak. Will I still be infected by the previous Delta variant after getting Omicron? Generally not. The antibody produced after getting Omicron also has a preventive effect on Delta variant infection, so you are protected somehow. If I have recently contracted the new COVID infection, do I still need a third booster shot? Because more than 95% of the newly diagnosed new COVID infections are Omicron infections. After infection with Omicron, you can not only generate immunity against Omicron, but also generate immunity against the previous Delta. So do not need a booster shot for the time being. So what should I do if I am diagnosed with a new virus? First, you have to self-isolate. Symptomatic treatment is enough. For the treatment of sore throat, try the following methods like gargling with hot salt water, drink more warm water with honey. Lozenges can help because there is a small amount of anesthesia or anesthetic effect which reduces the pain. Many lozenges have a good effect on the throat. So you can ask your doctor to prescribe various medicines for you if it is not getting cured by these medicines. For other symptoms, like try the following. They can take paracetamol, can be used for fever 650 milligram. For headache, joint pain, you can give the take medicine. Some anti-allergic medicines can be used if there is a nasal congestion or there is a cold. You can use levocetirizine. If you cannot sleep due to sore throat at night, you can use the same antihistamine. It will make you sleep. The cough, no need of any cough medicine. If you give rest and if you can do steam inhalation, or if you give some time, the cough will go. Most importantly, self-monitoring of your blood oxygen concentration is the most important thing. If it is below 94%, you have to go to hospital immediately. If you belong to a high-risk group, like you have cancer or you have done a kidney transplantation or you are doing a dialysis, then you can think about considering monoclonal antibodies. Otherwise, monoclonal antibodies are not required. So you have to think according to your disease severity, and it should be taken within 5 days of onset. So that you have to understand. It was very effective in controlling the Delta variant complications, but Omicron, if you are having such sort of symptoms, you can think about it. How long should I self-isolate after getting sick? According to the CDC guidelines, self-isolate for 5 days minimum, then wear the mask for 5 days. This is the CDC recommendation. But better for next 14 days, if you can self-isolate it is the ideal way. 10 to 14 days, if you can isolate, that is the best way, because you will not spread the infection to other people. Is there anything to prevent Omicron infection? There are so many things you can do. There are some things like you can use the N95 mask. Then you can stay in the room with more ventilation. Then always don't go to the crowdings. Wash hands frequently. Maintain proper social distance at all time. In addition, some health products many people are trying, like vitamin D, vitamin C, zinc, etc. But we don't recommend that. No need of that. Most importantly, you have to drink enough amount of water, sleep adequately, and if you are smoking or drinking alcohol, try to stop it. Don't take processed food or refined flours and sugary drinks. This will reduce your immunity. So this is a very important information about Omicron. Please share this information with everyone. We will come with another good topic soon. Take care all.